I'm Natalie. I'll be your nurse for today. We have a doctor's orders to do a dressing change. But before that, can I please verify you with a full name and date of birth? Once I have the patient's full name and date of birth, I'm going to go ahead and explain the procedure to them. I'm going to go ahead and also take a look at the site to see from afar if it's still intact. And then once I've explained the procedure and I've put the patient comfortable and I've ensured that they don't have any allergies that contradict with the dressing change, I will go ahead and gather all my material. I have material here, right here, clean gloves, a central line change kit. I have sterile gloves right here. I have 3 flushes, alcohol wipes. I've improvised with the positive pressure valves and I put them in little packaging. I'll also have the bio patch would also be in its individual packaging, and then 3 Kuros caps, which would also be in their packaging, but we improvise right now. So I'm going to go ahead and give the patient a mask. They can either have the mask on, or we can ask the patient to turn their head away from the dressing change. Once they have theirs on, I'm going to go ahead and grab mine from the kit and place mine on. I'm going to go ahead and hand sanitize. Okay, once I have my hands clean, I'm going to don clean gloves. And I'm going to go ahead and note the dressing. I'll go ahead and ask the patient if it's tender, note if there's redness, warmth, and if there's swelling. I will begin taking off the dressing and starting where the catheter is. Once I've taken all the tachoderm off, I'm going to go ahead and discard it. I'm going to go ahead and check again the site, make sure it's not tender, swelling, redness, or warmth. Once I'm done with that, I'm going to go ahead and take off my gloves and set up my sterile field.
Dale.
Before setting up my sterile field, I do have to clean my hands once again, so I would sanitize my hands, or you could also wash your hands. Then I'd remove the drape from the kit, making sure not to contaminate it. Okay. I'm going to have this completely open, and at this point I'm going to go ahead and open up my positive pressure valves and place them inside my sterile field. The bio patch would also be in a packaging and I would place it in the sterile field. I'm going to also set up my saline flushes. This one is filled with air, not to ruin the mannequin from the inside. So I'm going to be using that one for the example. The other ones, I would also open them, make sure to expel the bubble. Place in there. now at this time, I'm going to go ahead and don my sterile gloves. Okay, I'm going to go ahead and take the ChloraPrep out. I break the wings and then push it against my palm, making sure to prime it. Now I'm going to go ahead and vigorously scrub around the catheter, around the line, for a whole minute. And I can go ahead and clean the line itself as well in the catheter. Once a minute has passed, I can go ahead and dispose of the ChloraPrep. I'd go ahead and grab my BioPatch and place it on there, making sure that the blue side is up and the cup portion of the BioPatch is going to go ahead and go along with the line. At this time, the patient would have positive pressure valves already on there, so I would go ahead and clean the rest of the line. I would use alcohol swab sticks, and again, I don't want to ruin the mannequin or anything, so I'm going to go ahead and improvise and use this Q-tip. And I would clean the lines with that. Once those are clean, I'm going to go ahead and place the Tegaderm on it. Okay. Once that is in place, I'm going to go ahead and grab an alcohol swab. Again, I would remove the positive pressure valve, and I'm going to go one by one. Clean the, making sure this is clamped. I'm going to clean for 10 seconds with the alcohol wipe. Adding the positive pressure valve on here, the new one, that is. And then I'm going to go ahead and attach the saline flush. I'm going to aspirate and check for blood return. I'm going to also note whether it was brisk or sluggish, and then once I see blood return, I'm going to go ahead and push in the saline flush, and I'm going to use a push-pause method, creating a turbulence. Alright, once I have that off, I'm going to go ahead and replace it with a new Kuros cap. And I would repeat that 2 more times with each of the lines. And then I actually forgot to note that I would unclap that before putting in the saline and then again reclamp it, making sure the clamp is off. Once those are clean, I'm going to go ahead and let the patient know that their dressing change is over. I'll discard of everything and then remove the mask, make sure the patient is comfortable, and